Thank you. Thank you very much, moderator, and my fellow panelists. I will ride on the already existing protocol, and I'll be sharing with you our experience and casting light into one of the programs that we implemented in the Kampala Metropolitan Region through the Kampala Metropolitan Local Maternity and Neonatal Systems for the region. So that is the team that participated in this work that I'm going to present. One of them could be seated next to you. So we call swap, and its goal was basically to improve the survival of small and sick newborns and pregnant women with complications leading to preterm birth. The project is premised around four major objectives, and that is improving identification of mothers at risk of preterm birth, improving essential care for newborns and facility-based care, as well as utilization of data and QI for the different processes and management of small and sick newborns in the different facilities. As earlier mentioned, this program is in the Kampala metropolitan area. We are in 3 health facilities in Kampala and one in Mukono and Wakiso each. And we chose those facilities basing on the volume and burden of the maternal and newborn conditions, as well as the volumes of referrals that we are going to the high-level facilities, and that is majorly to Kawempe National Referral Hospital. We did work with partners, the Ministry of Health, both local district governments of Mukono and Wakiso, Kampala Capital City Authority, the Value Global Health, and eWorld Technologies to be able to advance the work that we did in this area. So, as part of the approach that we used, the previous speakers have mentioned aspects of training, they've mentioned aspects of mentorship, and specifically to be able to achieve the goal of this program, we are able to focus on improving the quality of care of women at risk of pre-eclampsia and eclampsia, because these are some of the conditions that have the highest risk to women who are likely to deliver preterm babies. And in that, we focused on training frontline healthcare workers on the Helping Mothers Survive modules. As you can see, the different suites of training for the management of preeclampsia, eclampsia, bleeding after birth care, threatened preterm birth, and essential care for labor and birth. And in order for us to improve newborn care, we did establish and functionalized newborn care units and focused on innovative technologies to improve the survival of newborns. You're going to be able to look at some of those technologies and see what they're about. I know some of you might have already seen some of them at the booth or at the presentation that we were able to have yesterday. And we also advanced the Helping Babies Survive suite of trainings with the different packages. And through all this, we are able to have cross-cutting activities or approaches around capacity strengthening, infrastructure, and technology, where we're able to provide equipment, train the health workers to use them, but also support with the maintenance of the equipment that have been provided. We also supported or worked with the different structures in the different health facilities to use data for quality improvement, but above all, for them to be able to make decisions, both at facility and at district level, to improve maternal and newborn care in those facilities. Those are some of the technologies that we utilized. That's the Neonatal Live. It's a skills trainer for neonatal resuscitation that gives health workers instant feedback and just to improve the skills of resuscitation. We've seen the causes of newborn death. Birth asphyxia is top in the list, so this is a key priority that we're able to focus on to improve those results. The other is the CPAP. We've been hearing recommendations of CPAP since we started this conference yesterday, and that is the continuous positive airway pressure device that evidence has shown that it improves survival of newborns with conditions that is able to manage. So we utilized the variable CPAP, which is a low-cost device. Compared to conventional CPAP devices, it doesn't need electricity. It has movable parts and can be used during referrals, in addition to being able to blend the oxygen that it provides to the babies. If you have the chance, please join us at our booth. You'll be able to see how this device works and be able to have a number of questions that you have answered. So, to share some of the selected key results from this intervention of making functional these level 2 facilities where we're working and being able to train health workers, mentor them, provide equipment, what are we seeing? We are seeing that over time, these facilities are able to take care of these babies, and the admissions in these units are increasing. That's not the only interesting bit. We're also seeing that referrals are significantly reducing from these sites, meaning that the higher level facilities now have fewer unnecessary referrals going to them. They're able to focus on the few cases that go to them and provide the best of quality. And not only that, even the ones who are referred, they're referred because they are in very critical condition, but their survival has also been seen to improve. And you'll be able to see this in one of the sessions that we have this afternoon to dive deeper into this work around the outcomes. We also acknowledge that you cannot improve the survival of these newborns if you do not cause an impact on the mothers. That's why this project looks at both mothers and the small and sick newborns. And so through the band of interventions, we are able to improve some of the key evidence-based maternal interventions. As you can see, the use of antenatal corticosteroids, as well as provision of magnesium sulfate to mothers with preeclampsia and eclampsia, and having them improve over the time of the intervention. And looking at the outcome of the babies that were initiated on this low-cost simple device, we see that babies over time having their outcomes improved and weaned off successfully from this device that we utilize. I know those who attended the session on CPAP were able to see this. So yes, this device can also support the survival of newborns alongside the other interventions. And as you can see here, using some of these devices, we are seeing over time babies are being weaned off successfully and the deaths are reducing in these facilities. In terms of kangaroo mother care, we are also able to support the health workers to have this increase. You can see across the 5 sites, KMC was overall below 15%. And at the end of the program, we are seeing them soaring at almost 60% across the different weight categories. These are proven interventions that if we institutionalize them and expand them, they can really improve the survival of small and sick newborns, as well as the mothers who are likely to give birth to preterm babies. So we believe that strengthening level 2 care from the evidence that we've shown reduces unnecessary referrals to tertiary institutions. Low-cost technologies and devices can easily be adopted by the providers to improve this care. And we have also demonstrated the possibility of increasing uptake of underutilized high-impact MNH interventions, for example, the SCS and the mag sulfate for preeclampsia, eclampsia. And above all, we saw from yesterday's presentation, Kampala is one of the districts where the outlook is not very good. And so we believe that if we render level 2 care functional, we can improve the outcome of our mothers and newborns, and also contribute towards accelerating the achievement of the 2030 goals. Thank you very much, and we'll take any questions after.